If you care about your health, your confidence, and your future, this video is for you. I'm Dr. Jocelyn, and I've spent the last 5 years working in urology and men's health. Today, we're talking about 10 things you should never do to your penis, not just warnings, but essential tips to help you stay safe, healthy, and sexually confident for life. Before we dive in, do me a favor, hit that like button, drop a comment below telling me where you're watching from, and subscribe so you don't miss future videos. Let's get started. 1. Don't ignore your body's warning signs. Your penis is a powerful indicator of your overall health. In fact, studies show that men who develop erectile difficulties are significantly more likely to experience cardiovascular events within the next several years. Why? Because the blood vessels in the penis are small and delicate. Any problem with blood flow often shows up there first. Strong erections mean your circulation, hormones, nervous system, and mental health are all working well. So when things start to change, don't brush it off. Pay attention. 2. Don't try dangerous home remedies. I've seen everything in my practice. Men applying household substances, hoping for growth, homemade devices made from plastic bottles or metal rings. Please don't do this. These methods can cause serious harm, nerve damage, scarring, or permanent dysfunction. One common example, manual stretching techniques that promise increased length. These often lead to micro tears in the tissue and long-term injury. I've seen young men come into my clinic with lifelong problems because of this. Another danger, homemade constriction devices. I've treated men who ended up in the emergency room because they used bottle caps, metal objects, or rubber ties and couldn't get them off. Some required power tools just to remove the object. If you're going to use a constriction ring, get one that's medically designed, adjustable, and easy to release. 3. Keep things clean properly. This seems obvious, but it's often neglected, especially in men who are uncircumcised. If you have a foreskin, you need to gently retract it, clean underneath with warm water, and dry the area. If you don't, bacteria and skin cells can build up, leading to infections, inflammation, and even adhesions. And yes, there's a connection between poor hygiene and penile cancer. It's rare, but when men can't retract the foreskin and never inspect the skin beneath, early signs can be missed. That said, don't overclean or use harsh soaps. The skin is delicate. Let mild soapy water run gently over the area, rinse well, and pat dry. Avoid scrubbing, rubbing, or using strong fragrances. 4. Don't ignore pain, bleeding, or changes. If you feel pain during intimacy or urination, notice a lump, ulcer, or blood in your urine, don't wait. These could be signs of a urinary tract infection, a sexually transmitted infection, kidney or bladder stones, or in rare cases, something more serious. I understand it's uncomfortable to talk about these things, but early detection is everything. If you feel judged by your doctor, find a better one. You deserve care without shame or stigma. 5. Stay in control and be safe during intimacy. There is nothing more confident than being safe and in control. Using protection doesn't just reduce risk, it also allows you to relax, enjoy, and be fully present without fear. But safety also means physical control. Penile fractures are real, and they're surgical emergencies. If your erect penis bends suddenly during vigorous activity, especially from accidental impact or thrusting at the wrong angle, you can rupture the outer tissue. You'll hear a pop, feel intense pain, and notice swelling and discoloration. If that happens, go to the emergency room immediately. Early surgical repair gives the best outcome. Waiting too long can lead to permanent dysfunction. Use lubricant generously. It reduces friction and the risk of injury. And remember, losing lubrication doesn't mean your partner isn't aroused. It can be caused by hormones, medications, or even stress. Lube helps everyone. 6. Don't overheat it. Testicles are outside the body for a reason. They need to stay cooler than your core temperature to produce healthy sperm and testosterone. Avoid prolonged exposure to wet heat like hot tubs, saunas, or keeping a laptop directly on your lap. And keep your phone out of your front pocket when you can. All of these things can affect sperm quality and hormone levels over time. 7. Be gentle when you masturbate. If you're using intense pressure or gripping too tightly, your body can become desensitized to normal arousal. This is sometimes called death grip, and it's one of the most common causes of decreased sensitivity and delayed response. If you find that solo stimulation feels better than intimacy with a partner, that's a sign your technique may be too aggressive. Try switching it up. Use lubrication, slow down, and retrain your body to respond to a wider range of sensations. 8. Don't smoke and take care of your body. Smoking is one of the fastest ways to damage the blood vessels in your penis. It's directly linked to erectile dysfunction, and it also increases your risk for bladder cancer, one of the most aggressive and difficult to treat cancers we see in urology. Your lifestyle matters. A healthy diet, regular exercise, and managing stress can protect your erections and your life. Aerobic exercise improves blood flow. Resistance training supports testosterone. Reducing alcohol, avoiding drugs, and getting good sleep all play a role in your sexual health. 9. Be kind to yourself. This might be the most important one. Men often tie their self-worth to their sexual performance, but the truth is, everyone has off days. If something doesn't go perfectly, don't spiral, don't beat yourself up. The stress and anxiety you carry can actually make things worse next time, creating a cycle that's hard to break. Your body isn't a machine, it's human. Talk to someone you trust. Talk to a doctor. You are not alone. 10. Use it or lose it, sort of. When you stop getting erections, whether due to stress, relationship issues, or underlying health problems, the body can start to reduce blood flow to the area. You may lose sensitivity, notice slight shrinkage, or develop scar tissue. Nighttime erections are the body's natural way of maintaining penile health. If they stop completely, that can signal something deeper is happening. Intimacy, whether solo or with a partner, helps maintain oxygenated blood flow and tissue integrity. So yes, use it, protect it, respect it. If you're looking for a natural way to support stronger, healthier erections, I recommend checking out a watermelon-based supplement rich in L-citrulline, a compound your body converts into nitric oxide, which helps open up blood vessels and improve circulation where it matters most. It's gentle, stimulant-free, and designed specifically for men who want better blood flow without relying solely on prescription options. You can find the link in the description or pinned comment below. Gentlemen, take care of yourself. You deserve to feel confident in your body. I'm Dr. Jocelyn, and my goal is to help you feel informed, confident, and empowered in every stage of your life. If this helped you, share it with someone who might need it. And before you go, like this video, subscribe if you haven't yet, and drop a comment below. Let me know what's one thing you learned today. Remember, you're not too old, you're not broken. Small changes can bring real comfort, freedom, and confidence. Take care of your health. You are worth it.